I'm Dr. Joe Thomas, and this is the Eighth Note Sessions.
Every day I wake up at 7 a.m. Drink my coffee, eat breakfast, and I'm off to work again, where I do the same.
All right. Welcome to the Eighth Note Sessions. I'm Devin Mullen.
And I'm Mike Shamil.
And tonight we are joined by hospitalist Dr. Joseph Thomas. Doc, how are we doing today?
Pretty good. Thank you for having me back.
Thanks for joining us. So we asked you on the show tonight because we've had you as a previous guest, and we've sort of been keeping tabs on the pandemic as it's progressed, and enjoyed talking with you because you have really immediate frontline experience with it. We are in kind of an odd position right now.
It's a good way to put it.
Yeah, we've seen the sort of resurgence of the virus under a new variant named Delta, and the way forward ain't so clear. There's a lot of different information being sort of shuffled about, and how we as engaged, mindful citizens is changing from the day to day. What are your bits of advice on that?
So, you bring it up in a good way. The virus has resurged in many parts of the country. We're seeing numbers close to what they were in peak 2020. Hospitals are filling. Hospitals are having to divert patients again and stop what we call elective surgeries, but are really just non-emergent surgeries. But they're still necessary. And all of that has to get put off again in service of people coming in incredibly sick again from COVID-19, a lot of times the Delta variant. Right now, where we live, it is under control still. There are a handful of patients in the hospital with COVID-19 right now, but thankfully it is still just a handful. That number might be rising, and that's what we're all concerned about at this point. And so that's why things have started to change again with our guidance on how we go about the public. The biggest thing remains to get your vaccine, and I sound somewhat like a broken record on social media, but that's all I can. That's the most I can say right now is to get your vaccine, because that's the thing that is going to protect us all. No vaccine is 100% guaranteed for the individual, but if we all get vaccinated, then there's that blanket of protection that we could secure for ourselves and for those of us who cannot yet get the vaccine or cannot mount the immune response that the rest of us can accumulate. And that's also why masks have come back. The resurgence and the fact that we don't have enough of the population vaccinated yet means that this Delta variant is very contagious. It's more contagious by a significant degree than original COVID-19. And so we've asked people to start wearing masks in indoor areas, and especially, admittedly, this is just the three of us. So the mask, and I know your vaccination statuses and you know mine, so I can feel comfortable not wearing a mask. But in indoor areas where you're not sure, or if it's more crowded, then definitely be wearing a mask. If you're outdoors, and again, if you're in a crowded place where there's a lot of people, especially if you don't know their vaccination status, again, we advise masks there too.
Beautiful. So in true, we'll say 2021 fashion. I don't even know what this year is, but
who knows?
The public health response to this is kind of one of opposition and adversarial sort of thinking. And there's a lot of finger pointing at folks who are either vaccine hesitant or full-blown anti-vax. And that's all well and good. But do you think that the problem solely resides in that demographic, or are there larger forces at play that we're to contend with?
That's a really good point. And no, I don't think it is solely the vaccine hesitant or even the outright anti-vaccination crowd. That is a frustrating demographic, but that's who I try to reach the most. And I've never been good at insults anyway, and so I try not to insult those folks, but I do try to reach out to them as best I can and try to figure out where their hesitancy is coming from and try to address that, whether it's a skepticism of the medical system in general or if there's misconceptions about COVID-19. We'll get back to the misconceptions part in a second.
Sure.
But there is a substantial amount of people that either cannot yet get the vaccine or cannot mount the immune response that they should. And I mentioned this a little bit earlier. The biggest demographic right now is children. Teens under 18 are eligible for the vaccine as long as they're over 12. But there's a substantial amount of hesitation there, which is understandable given parental responsibility. But we've seen that those, the teens that have gotten the vaccine, most of them have done very well. If there have been side effects, they've been minimal or they've resolved fairly quickly. The biggest ones that can't get vaccinated right now are children under 12. We're hoping to see emergency use authorization and hopefully full FDA approval by midwinter. That was originally planned for the early fall, and then it got pushed back because they wanted to get more people in the trials, and those trials are recruiting. But I'm hoping that we'll see that soon as these trials get underway and that monitoring happens. But until then, those folks, our children, our most precious of our population, are not yet protected. And that's why I am a staunch advocate of masking. I'm not a parent, but big staunch advocate of masks in schools for everybody until they can get vaccinated, and getting everybody that can get vaccinated as soon as possible. And that also applies to people who are immunocompromised, people who have had organ transplants or other autoimmune diseases where they have to take these medications that suppress their immune system and therefore can't mount the same immune response that the rest of us can. And we've seen that. And the FDA announced this week that they're going to approve a booster dose, a third dose, or an additional mRNA vaccine dose to those who have gotten the single-dose vaccines for that population. The evidence hasn't been strong enough to recommend boosters in most of us that have, for lack of a better term, competent immune systems that can form that response. But for this population, the boosters are about to be approved, or they have been approved.
So something that's kind of comes up in this framework is an idea of government overreach that, like with a lot of and sometimes it can be sort of self-defeating, in terms of the politics surrounding it. The idea that government shouldn't tell you have to wear a mask. And there are some pretty heinous memes which have come up, saying lightly that this is an infringement on my civil liberties. But, you'll see just horrendous images accompanying that. For me personally, that doesn't carry much water. The sort of equivalency that wearing a mask is an infringement on your civil liberties. Is there any kernel of what's the good takeaway from that?
I think that part of that comes from an overall skepticism of government in general, which there's plenty of, and even in medicine. There used to be a very paternalistic attitude that medicine used to have, and those of us that are coming up now are trying to erase that and make more of a team-based approach with our patients. The idea that mandating masks or even vaccines or having a vaccine requirement to go places is an impingement on civil liberties doesn't hold much water for me either. I understand where it's coming from, but I think that's different in matters of public health. It's not the same as, because people always want to complain or compare it to sugary soft drinks and fatty foods and such, but those still remain very individual risks that people may or may not take. Whereas this is more like traffic laws and seatbelts and traffic lights and lanes. We're all told and required, and you have to take a test to ensure that you will follow those rules and understand those rules because of the danger that you can pose to somebody else when you're on the road. And the same thing goes right now for COVID-19. Masks and vaccines are the way we prevent other people, because I can't tell you how many people I've treated in the hospital who did everything they could do. They stayed at home. They wore masks whenever they had to go out. They cleaned off all their stuff. But a relative who saw somebody else maybe wasn't as careful, or they had a friend who wasn't as careful, and then they bring it to this other person, and that's the person that first person is the one that gets sick and ends up in the hospital. And so requiring masks and vaccines prevents that spread and prevents people from dying, frankly. And so I don't think that is a sacrifice of civil liberties or an impingement on civil liberties. I think that is public health, and that is what we have to do to get out of this mess.
So going further with that, if we're talking about public health, one of the, I would say emergent threats to democratic and enlightened discourse is dis and misinformation as it stands. And in terms of COVID vaccines and the efficacy of masks and just generally accepted and agreed upon scientific knowledge, all these things are sort of being called into question. Especially on social media, where these sort of misleading, ambiguously sourced claims are abundant.
But I got these memes that my friends shared to me, and they align with my bias. They're right, right? Yeah, they're right.
What? How?
Sorry.
No, that's great. Thank you for the levity. I appreciate it. Getting too deep into it. But how do you sort of sidestep that process, and how do you speak with people who are utterly convinced on essentially this house of cards reality?
Right. I appreciate you bringing that back up, because that was a point that I had started to address earlier and then got off on my own tangent. But yeah, there has been more than ever this rampant misinformation, which is a misunderstanding of a concept or a medical item, and disinformation, which is the purposeful spread of misinformation or of false information to gain some sort of secondary prize, whether that's clout or money or grifting somehow. And it's more apparent and more rampant than it ever has been, because of the ease of the internet and of social media. They've actually found that 60 or 70% of the false medical information out there can actually be traced back to 12 people. They call them the disinformation dozen. Joseph Mercola, Sherry Tenpenny. There's a few other ones. 10 other ones to be exact.
Names.
Right. And they have these catchy memes, or these juicy tidbits where they frame it as the conspiracy. The CDC's been lying to you this whole time. Now, I should say, I've had my disagreements with the CDC on some of their messaging. I mean, I'm just a schmuck in Buffalo, but I've had my disagreements with the CDC in terms of messaging and in terms of some of their recommendations. But overall, the CDC and the WHO have done everything they could to evolve with the science. But you get these folks that spread these memes because they're catchier, they're phrased well, they sound scientific. Even if you look deeper or if you have an understanding of what they're trying to talk about, it's hogwash. The most recent one was a doctor named Dan Stock, who was in this. There's a video of him circulating now at a school board meeting in Indiana, and he talks about himself as a functional family physician, which is not a recognized specialty. There's a definition by the Cleveland Clinic, and he completely misstates that definition, overstates his own expertise. And he goes on to talk about several scientific sounding concepts, and he gets every one of them wrong. And so my, can I plug my own blog here?
Yeah, because I was going to bring that up at some point.
Shamelessly, I have a blog, and it
evolved out of your Facebook post where you were trying to, educate people and start swatting at these disinformation flies on your feed.
And that's exactly what it is. Also, I'm really grateful that all three of us talk with our hands, so I don't look as ridiculous. But yeah, that's exactly what it was. I started making these Facebook posts to try to address all this disinformation, and I had friends who weren't on Facebook. I also tend to wax quite poetic about some of these things, so I started a blog, and I had to address a lot of these claims, and so my latest blog post has done that, and several other scientific communicators who are able to dedicate far more time than I am have done so as well. My favorite one right now for this particular issue is a guy named Ed Nierenberg. He runs a site called Deplatform Disease. And if you go to his website, he's got a whole thing where he, blow by blow, goes through each concept that is talked about in this Indiana school board meeting and how the guy got it wrong. And we don't do that for our own, like we're not happy about this, but there's so much misinformation and people seize on that, because everybody's looking for an easy way out of this pandemic, and there isn't one.
Sure, because vaccines are scary and needles are scary, and no one wants to deal with allergic reactions to things, and some people are just willing to try and sidestep as much as they can and ignore that responsibility.
It's true, and because this, everything did happen very quickly, and so people think that, excuse me, people do think that steps were skipped in development, that it, the persistent myth that it hasn't been studied enough when it really has. We've had mRNA vaccines created for the last 10 or so years. They, the diseases they were designed for, either those diseases died down. The pandemic died down, things like Zika and the last round of Ebola. But they made mRNA vaccines for those. They just never had to make it to the distribution phase. And the other problem we had was that we only recently kind of figured out how to store mRNA vaccines because it is such a unstable molecule. And so it has to be kept in these ultra cold temperatures, like -80, which is not something that is readily available to a lot of the public. And that's why distribution was so difficult, even with this round of with this round of vaccines. But that doesn't mean they're new. And we've been studying them for years and years. The idea that we don't know what the long-term side effects are going to be. Any side effect that has come from a vaccine has emerged in the first 6 to 8 weeks. Coincidentally, to get emergency use authorization for a vaccine, you have to monitor after the phase 3 trial, because you still have to go through phase 1, 2, and 3. You have to monitor for 2 months, as opposed to FDA approval, which is 6 months. But 2 months. So that includes that 6 to 8 period. So we would have seen any side effects, any long-term side effects that came from these vaccines. And now we're a year out from the phase 3 trials of the Moderna, the Pfizer, and the J&J trials. We're rapidly approaching that with AstraZeneca, and there have been, I think the last count was 4.4 billion doses of the vaccine given worldwide.
That's not enough. We've eaten more Big Macs than that. But it is.
You're very true.
It really is. I mean, it's, all joking aside, I mean, that's a huge amount of data and test pool, isn't it?
It is. And that's why we see the data come out, and we do see these very rare side effects. People were afraid of blood clots and myocarditis, which is an inflammation of the heart muscle. But those effects were for every million doses. I think there were 12 cases of myocarditis, and I think 3 cases of vaccine-induced thrombocytopenic thrombosis, the blood clots. That's such a small number. It's so unlikely. It's almost hard to attribute these conditions to the vaccines, because there's a decent chance that those would have happened anyway in a population that didn't have vaccines, and that's what we compare it to. That said, we do tell people to watch for those symptoms, because the most you'll get is if you get a persistent headache, if you get some chest pain, you get checked out. But a lot of times these things are treatable and or they resolve on their own within a matter of days to maybe a week. And that's only if you get them. They're so rare. Most of the time, any side effects you get from the vaccine wear off within 36 hours. But it's hard to drive that home when there's so much other disinformation out there trying to take away from that.
I think part of the problem is the language of science as it sort of speaks to those who aren't, in a scientific field. And if what we've seen from 2016 is any indication, public shaming isn't really, whether or not it's virtuous, that's another discussion, but it's not effective.
Right.
It doesn't bring people over to the common point of understanding or anything.
Agreed.
There's one of the common talking points, I guess, from people who are basically pandemic denialists, which is a wild thing, is you had said that it's hard to attribute deaths from inflammation of the heart or the blood clots to people who received the vaccine. There's a sort of counter-narrative that it's hard to attribute deaths where there were underlying conditions to COVID specifically. Why is that not necessarily the case? Why is that claim false?
So there's a couple of ways I could address that. There was first the myth that still persists. I've found recently that we were faking diagnoses of COVID. People would come, the common meme was, people went to the hospital with a car crash and they were labeled a COVID death. That's not really how that works. There's too many oversight factors. There's too many people in a hospital to fake a diagnosis. You have to write notes. You get audited. There are other people looking at those notes. There are doctors, there are nurses, there are administrators. And if people were trying to fake their way through a diagnosis, people would say stuff. And there are avenues for that. And so we don't do that. The way death certificates work, I've addressed this before, but you have the principal cause, which whether that was a cardiac arrest or a respiratory arrest or some other factor, and then what it was underlyingly due to. And for my COVID patients, it's usually the respiratory failure and a lack of oxygen, an inability to breathe due to a viral pneumonia caused by COVID-19. And people were like, hospitals are getting more money for COVID diagnoses. The way that works is it's an insurance thing. If you diagnose somebody with pneumonia, that merits a certain amount of reimbursement from the insurance company. But if you say acute lack of oxygen and respiratory failure due to a bacterial pneumonia secondary to Streptococcus pneumoniae, the bacteria, if that's what grows on their culture, that merits a higher level of reimbursement. And the same thing with a viral pneumonia due to COVID-19 or due to whatever other virus. So that's that piece. And then the other talk about underlying conditions. that's because that was the pervasive thinking at the beginning. Was we thought that people with chronic conditions would be more susceptible to COVID-19. But if you did a deeper dive, the most, of all the groups of people that were labeled as having underlying conditions, the most common underlying condition was high blood pressure, something where, so many Americans have it, and they may, some of them take multiple medications for it, but many people take a pill, and it controls their high blood pressure, but that's still an underlying condition. People thought the elderly were more susceptible, and to some extent they are, but I've had plenty of patients that have been as young as the two of you and me, because we're all the same age, and younger. And now with the Delta variant, we're starting to see children in higher numbers who have no underlying conditions. Some of them do, but many of them don't. And people are still getting sick. People are still ending up on massive amounts of oxygen in the hospitals, needing heavy doses of steroids and other treatments, ending up on ventilators. And it doesn't matter what their previous health was. Once you get it, if you come through it, that's wonderful. But there's a chance that you can get heavily affected by it, and it doesn't care about what you had going on before.
So to pull back from that sort of precipice of oblivion, because talking any plague narrative, it brings it down. Erie County, relative to the rest of the world, seems to be doing pretty good at this point.
Go Erie County. Seriously. Keep it up, guys.
And an outlook not rosy by any stretch, but maybe less disastrous than I would have seen a year ago. We've to bring back to the root of this podcast. We're usually here to talk about music.
Right.
Right. So we've seen a return of live shows in full force. I've seen you out at shows and and everything. We're putting on a big festival next month, 9/11. Are you going to be in attendance?
As of now, yes.
Okay.
I'm off that weekend. I've been looking forward to it for a while. And you're right. Erie County and large swaths of the Northeast in general have been doing relatively well. There is still a resurgence in transmission, but it hasn't been as bad as in other parts of the country. That could change, and maybe things will get worse. But as it stands right now, I'm hoping that it will be. If it is, it'll be small and it will be controlled quickly, and hopefully more and more people will get vaccinated to protect us from that. But to talk about what we're talking about, yes, I have been looking forward to Music is Art for quite some time. It's my friends. It's the connection to the Buffalo music scene that I didn't quite have before, and that saw a, for lack of a better term, resurgence in this.
A good resurgence.
The best resurgence possible. And so I've been looking forward to seeing all the performances there. And I think that going back to what I kind of said at the beginning, because a lot of this is outdoors, if you're in a crowded area, if you're shoulder to shoulder with people, I would bring a mask and probably put that on just to prevent transmission. If you're away from the crowd a little bit, if you're just with your friends who you know their vaccination status, yeah, take off your mask. But just be a little bit more diligent than you might have hoped to be. And I think we could still have a great time.
Beautiful. Beautiful.
That's what I'm looking forward to. I said that's what I'm looking forward to. Jeez. I want to double back a little bit to vaccinations. I know we just got back into music, but I'm just going to, pedal us back a few steps. For the folks that have gotten vaccinated early on and now they're already 6 months or past their 6-month point, what's in the near future for them? Do you think it's getting close to the possibility of a booster shot for them, or are they bueno for now?
That's a good question. I'm in that early category. I got my vaccinations. My second dose was January 5th. they offered them to the hospital workers, and so I jumped at the chance. As we stand, as long as you are not on any immunosuppressant medications, the data shows that our protection is still good. Even against Delta variant, the mRNA vaccines especially still have a pretty high level of protection, a high level of antibody creation against even the Delta variant. It is slightly lower, than it was to the original COVID-19, but still plenty of it. It's still been very effective. It still meets the endpoint of what the original goal of the vaccines were, which is preventing hospitalizations and severe illnesses and death. We've seen, and I promise I'll bring it back, but we have seen some outbreaks in places that have had high vaccination rates, and the headlines have been the most recent, or the biggest story recently was Provincetown, Massachusetts, and the headlines were 74% of COVID-19 victims were vaccinated. But when you have a city where 95 or 99% of their population is vaccinated, if there's an outbreak, it will be mostly vaccinated people that catch it, because you can still catch it, COVID-19 even with the vaccine. However, those people were ultimately far more protected. The people that suffered the most and around the United States continue to suffer the most, continue to be the longest hospitalized, and have the most requirements in terms of intervention, remain the unvaccinated. Baton Rouge released statistics recently. 99% of people with COVID in the ICU are unvaccinated. And that 1% is still a very small number. I think in some places it's even smaller than that. But, so going back to your original point, as of now, if you got the mRNA vaccines, it is not recommended. We don't have enough evidence to recommend a booster at this time. They're still researching that, so that may change. If you got the Johnson & Johnson vaccine or one of the other non-mRNA vaccines, they're looking into that too. Definitely for those in the immunocompromised category, but even if not, there is some evidence to show that if you had a single-dose vaccine or a non-mRNA, and then you get an mRNA vaccine after that, your immunity does rise substantially, where they had a little bit lower efficacy against Delta variant. So that's where we're at. And there will be more on that to come, and it'll be on my blog.
So generally speaking, to sort of sum it up, it just gives you slightly thicker skin. So you'll have a paper cut instead of a gouge.
It's yet another layer of protection. Yeah. Absolutely.
Now we're almost out of time, so real quick, back to rock and roll in music land. I know it's a little bit jarring. Can you give us the quick spiel of what you got coming up?
Thank you. So I play in a band called Mayday Buffalo, and we're 90s and 2000s mostly, but we do a little bit of every decade in covers, and we've got some originals too. We've got a few different shows coming up. I think we mentioned that our next show might be before this actually comes out, but that's okay. We play at the Transit Music Lounge a lot, and so you'll probably catch us there. The next public show we have is the Elk Street Car Show at the end of August, so if you like cars, you'll see us there. And I do play around with some other folks, Sarah Elizabeth, who I know has been on this podcast before, and has been a longtime friend and collaborator of mine. You might catch me with her at one of these gigs. Nothing on the books as of yet, but whenever I'm off from the hospital, and she is gracious enough to allow me to play. And then I play with Michael Nowak, and I think the last Friday in August will be at Dwyer's, I believe. And so you can catch me there too.
Beautiful. Well, Doc, thanks so much as always for making time out of your busy schedule.
It was my pleasure.
Well, hopefully this will be the last time we speak, but I have a feeling.
Well, at least about
in the
COVID.
podcast.
Yeah.
Obviously,
Yeah.
COVID. Hopefully, other things in the
Yeah,
future.
let's have
They're
a drink
like your bow tie
sometime.
collection. I just love them.
I do, and I wore the music one for this one, and I'll make sure I get some more for next time.
Love it. All right, and with that, I'm Devin Mullen,
And I'm Mike Shamil.
and this has been the Eighth Note Sessions. Catch you next time.